The nursing home, final rest for living decay? An indictment of the neglect of human dignity in elderly care by Gurubsar, Lankar Ida Baguz. A nursing home should be a safe haven, a place where the elderly, after a lifetime of hard work, love, suffering, and care, can spend their final years in peace. It should be a sanctuary of compassion, attention, and respect. A place not just for physical care, but where residents are still seen as human beings, with histories, desires, pain, and an unalienable right to dignity. Sadly, reality often tells a different story. In the Netherlands, a country that prides itself on being civilized and compassionate, abuses in elderly care persist behind closed doors. Many people prefer to look the other way. But in numerous care homes, scenes unfold that resemble a silent protest, cold treatment, abuse of power, emotional neglect, and at times, outright psychological violence. Older adults are no longer approached as vulnerable individuals, but rather as burdensome objects of care. Care workers, often overworked, underpaid, and stretched thin, can grow disillusioned. Empathy gives way to detachment, or worse, harshness. Elders are snapped at, belittled, or simply ignored. They are shuffled from one person to another for something as simple as a glass of water, left waiting for help to the toilet, and spoken to like children, patronized or commanded. The peace of a nursing home is often just a facade. Those who dare to speak up or voice complaints risk being labeled difficult, ignored, or subtly punished through emotional coldness or social isolation. The pain of being unseen. We are speaking of people walking the final stretch of their lives, people who may have already lost much, a spouse, a home, their independence. They do not deserve to be silenced or forced to conform to a system that fails to see them as individuals. Some residents go for days without seeing anyone but rushed staff members darting from room to room. Activities are cut due to budget constraints. Warm conversations are replaced with sterile routines. The soul is forgotten at precisely the moment it cries out most for recognition. Where are the inspections? Where is public outrage? It is painful that the voices of these elders barely echo in public discourse. As if they've been written off, muted, no longer considered part of society. And yet, they have so much to teach us if only we would listen. Thankfully, there are still caregivers with hearts of gold, people who show genuine dedication and warmth. But even their noble efforts are often overwhelmed by a system driven more by numbers, targets, and red tape than by humanity. Elder care must be humane, or it has failed entirely. We can no longer sweep these failures under the rug. The elderly do not deserve neglect, indifference, or a life void of soul and meaning. They deserve gentle hands, kind words, and above all, the right to live their remaining days in dignity. The end of life should not mean a sentence to suffering. As a society, we must re-evaluate how we treat our elderly. Not merely as care recipients, but as people. Real people who feel, who hope, and who, until their final breath, deserve to be met with respect.